Yeah, so know about the global mental health crisis here, which roughly tells about 1 in 8 people worldwide suffer from mental health disorders. Yeah, it's a report from the World Health Organization. Yeah, and even in high-income locations, the treatment coverage is typically just 30%, and then in low and lower middle-income countries, there are only 8% that can receive treatment. Yeah, and according to a study from the American Psychological Association, every 6 in 10 psychologists no longer have opening for new patients. Yeah, this happens to myself pretty much when I was trying to search a therapist, and then most of them tell me, okay, I no longer have openings currently. Yeah, so there's a couple reasons that results in this global mental health crisis. Um, First, there's a severe scarcity of mental health professionals, but the patient amount is really, really large and even get increasing. Yeah. And second, poor quality of service and supports. Like training professionals require many, many efforts and other mental efforts. Yeah, but as a result, many professionals they do not have sufficient skills. And third, which is also a result of the first two reasons, is the unaffordable cost. For most people with lower or middle income, they cannot afford a therapist. Yeah, and also as well as the social stigma, like there's this discrimination of you if you stand out and speak, okay, I have a mental health issue, and many people just try to cover that, and et cetera, so many reasons. Yeah, so here, this research direction of mine, I'm trying to address all of those challenges by how to introduce AI to help to assist these mental health issues. So why are we doing NLP for mental health? Yeah, because in mental health, therapy takes a pretty major part where the major form of therapy is just talk, a conversation between the patient and the therapist. Yeah, so it's like in nature a type of conversations. Yeah, using conversations to convey information and then to do this treatment. So it's also kind of one of the coverage of the NLP challenges. Yeah. So if we can develop some AI models and NLP models to automatically analyze the patient's speech, there should be a really, really good improvement for the current global mental health crisis. Yeah, so here's a recap of the recent growth of all the NLP models. You may heard some of them, like the pretty famous ChatGPT here. Yeah, basically since the 2017, the invention of the well-known transformer neural network architecture, and then in 2018, which is the invention of the first popular language models, which is BERT. And after that, we really have this huge wave of all kinds of language models. They are growing larger and larger, and they can speak more and more like a real human here. And yeah, here's a more fine-grained picture of all kinds of different language models are from different big companies. You can see the Llama from Meta, and then the Gemini from Google, and then the ChatGPT series. Yeah, no way. Like much of us, we kind of use ChatGPT, this stuff every day. As for myself, I use it for my writing assistant pretty much. Yeah. And why there's a potential that using LM for mental health can help. There's many, many research that recently shows that LM has really astonishing ability in various textual reasoning tasks. Like on the left-hand side, it can solve math word problems based on the problem descriptions, yeah, and generate pretty good reasonings, and it can coding and like various of those copilots and cursors that you may use recently, and it can even simulate a text-based games and perform pretty much good reasonings. Yeah, and this is a report from the GPT-4, and they show that ChatGPT they can even do this pretty good in the theory of man test, which is ability to attribute the mental states just as the beliefs, emotions, desires, intentions, and knowledge, and even among multiple persons, and then the GPT-4 it can analyze and simulate them pretty good. So that's how the two inspirations that kind of inspire me that maybe this large model they can do really good in supporting the mental health. Yeah. So here's a overall roadmap of my research in these directions. First, I want to explore whether we can develop some ion-based AI applications to serve as an AI therapist to like serve as a form assistance to a human therapist. For example, when I talk with a patient, when I review the patient's theory, I can have this IM to analyze patient speech automatically and generate suggestions for you. Yeah. And the second direction, which is the one that I'm going to talk about today, is whether we can, it's on the another side, whether we can use IM to serve as an AI patient to provide training for human therapists. Like one challenge I talked about before, like the training cost for professionals are really, really high today. Yeah, and here I want to explore whether we can use IM to simulate a AI patient that can be used to train the student professionals. Yeah, so here is my work, which is accepted at the EMLP in last year, and it also got a best paper award as a Neuropedestrian for Health workshop. Specifically, how do we use large language models to simulate patients to train mental health professionals? Yeah, so before introduce this work, I want to quickly briefly introduce the cognitive behavior therapy, which is a therapy paradigm that I studied in this work. So for CBT, its core is about studying the connection between a person's thoughts, emotions, and behaviors. And then it says that basically these three parts, it kind of affects a people's mind, like with each other. Like typically what people think, it will affect their emotions about a certain event. Yeah, and their emotions will further trigger their behaviors. And then these three parts will simply affect each other. Yeah, and about the people's thoughts, they give a cognitive model of these three layers, which is in the center, there's a core belief of a person. And then outside of the core beliefs, it will trigger some intermediate beliefs. Yeah, and then when certain event happens, and then based on their core belief and intermediate beliefs, they will have some automatic thoughts. And then for depression patients, and then these thoughts are typically negative thoughts. Yeah. And here's an example cognitive model based on the CBD series. Like here for this patient, his core belief is like, I'm trapped, I'm unlovable. Yeah, and then they establish this core belief due to various reasons. Yeah, and then from these core beliefs, it induces some intermediate beliefs. For example, okay, I must avoid conflict and maintain peace with other person. Yeah, I don't have the power to stand up for myself, and so on and so forth. Yeah, and based on this belief system of this patient, whenever something happens, like this situation, having a conflict discussion with their mother over the weekend, and then it will trigger some automatic negative thoughts, like they will think about my mother will always control the situation, I'm powerless, I can't assert myself, cannot win this, and then these thoughts will further trigger the emotions, all these negative emotions, and then lead to all those negative behaviors. Yeah, so this is an overall like diagram of how a depression patient's thought and how their mind is constructed and they're reacting to external events. Yeah, so yeah, and here's this work I'm going to talk about. It's a joint work from this many universities, and thank you so much for my mentees and collaborators. Yeah, so at the first of this work, we first conducted a formal study with several real-world mental health professionals and students, and then trying to interview if there is a disconnect or gap there that we can fill with AI-based simulated patients. And then based on their response, we studied that we get that currently their training was mostly by reading some manuals and transcripts, or like watching videos or doing role plays with other students in the school. Yeah, and before they began to practice with real patients, they don't get enough opportunities to interact with real patients by their own. They say that manuals can often make it feel quite clean, but when you're in the room with a real patient, what they're actually saying can actually be quite messy. Yeah, so they acknowledge that there's a gap here. Yeah, so as a result, all the interviewees, they all respond pretty positively about our idea of AI-based simulated patients. Yeah, they think that AI could be an effective tool for training to help bridge this gap between learning manuals in the school and then practicing with real patients. Yeah, and also we learned that in real world patients, they can have different conversation styles that is not covered in their courses. So there are two major challenges that if we want to build this patient simulation. The first one is about the fidelity. Yeah, definitely if we want to bridge this gap up, we need to simulate a patient that is more real. It's like a real patient, but not look artificial. Yeah. So how should we build a simulated patient that closely resembles the communication behavior of real patients with mental health issues? Yeah. After we can simulate a real patient that looks really real, the next one is about the effectiveness. Is that how can we design such a training scheme that can actually get the students trained? Yeah, it's like after the students chatting and talk with this patient, and then what's next? How can they get feedback and how can they get trained? We need such a training framework. So based on these two challenges, here's an overview of the framework that we propose to resolve this challenge. So first, we combine a cognitive model with a large language model, and then combine them together by prompting, and then to serve as our simulated patient. And next, this red part is about our training framework. We have the trainees to role play a session with a simulated patient. Yeah. And then during the role play, we ask the trainees to formulate, to reconstruct the cognitive model of the simulated patient. Yeah. And finally, as a feedback part, we compare the cognitive model with the ground truth cognitive model that we feed into the large language models. And then by comparison, the trainee can receive the feedback. Yeah, so here's a recap of the cognitive model that we used in our simulated patient. Yeah, which we just talked about. It has these many fields of how exactly the person's mind is structured. Yeah. So here we start with the cognitive behavior therapy. We use a cognitive model from CBT to construct our patient simulations. Yeah. So specifically for this work, we only focus on the stage of formulating a patient's cognitive models. Yeah, it's actually in real cognitive behavior therapy. There's many different stages and different sessions that targets at different parts. For example, here the work that we did in this work is only mostly for the early sessions of a new patient that where the therapist need to first talk with the patient and to construct the patient's cognitive models. Yeah, and definitely in later sessions, the next step would be after and we know the patient's cognitive models, they will try to talk with the patient, apply various techniques to try to modify those negative thoughts, to modify those intermediate beliefs and the core beliefs of the patient, to modify them into more healthy beliefs, so that this is a basic principles of the CBT therapies. Yeah. So in this work, our patient simulation, we start from the early phase of formulating a patient's cognitive models. Yeah, so you can see that from here, we kind of address those two challenges. The first, by combining the cognitive model with a large language model, we try to make it more real and really like a real patient. Yeah, and second, by targeting this stage of cognitive model formulation, we can automatically get our feedback mechanism here because we fill this cognitive model to simulate the patient, and then we ask the trainee to formulate the cognitive model, and here we can just automatically compare their formulations with the ground truth here so they can receive some form of feedback. Yeah. So in order to make this work, first, the core things here is that we need to make the patient simulation as accurate as possible to describe the underlying cognitive models here. Yeah, so this is a detailed overview of our framework. Yeah. So on the left-hand side, it's our cognitive models, which has the core beliefs and intermediate beliefs, and then all the automatic thoughts. Yeah, and then we use various kinds of prompts and structures to inject all these cognitive models into GPT-4. Yeah, and accompanied with that, we also summarize the following 6 conversational styles of real-world patients, which is actually resulted from our interview with the professionals, like a basic plain patient or an upset patient or verbose patient or reserved patient, don't say anything, or even pleasing patient. Yeah, and then we combine these two parts to jointly prompt GPT-4, which will be our simulated patient here. Yeah, and on the right-hand side, it's our patient simulation training framework. Yeah. So after we simulate the GPT-4, then we ask the trainees to chat with the patient by setting up the goal of constructing the patient's cognitive models. Yeah, and then during the talk with the patient, the trainee can begin summarizing and writing down the cognitive models. Yeah. basically to fill in all these fields by chatting with the patient. Yeah, and eventually when the trainee feels ready, he can click a button, and then the ground truth cognitive model that we use to construct this specific patient will be presented in the interface, and then the trainee will compare their own formulation with the ground truth here so as to receive the feedback. So this is our whole patient simulation framework here. Yeah. So the left-hand side is the cognitive models. So a question comes, how should we get these cognitive models? Yeah, we definitely know this. This real-world patient data is really hard to get. So in this work, the method that we take is that we try to hire two clinical psychologists to manually compose such a data set. So this is basically one of our contributions, the first data set of cognitive models grounded in CBT principles. Yeah, so we first collect some real therapy sessions, and then they prompt GPT-4 to create some summaries, and then we invite two psychologists to manually create some cognitive models by drawing inspirations from the transcripts. Yeah, it's more like to make up some fake patients with some fake mental models here, but we're making sure these fake mental models can actually adhere to the real world patients here. Yeah, so we end up with roughly 100 cognitive models that covers various situations and various core beliefs and then various emotions here. Yeah, so on the right-hand side is an example situation of a patient dealing with family dynamics. Yeah, so we have a total of around 100 pieces of these cognitive models. Yeah, next is about the conversation styles. We summarize the 6 types, yeah, from our experts, yeah. And then for each of those types, we have descriptions here, yeah. And then we combine these styles and the descriptions and then fill them together into GPT-4 to do a prompting, yeah. And on the right-hand side, it's an example conversation style of upset patients, yeah. So this is about how to construct our simulated patients. On the right-hand side is about our training tools here. So we specifically build a simple interface to test our tools. So here is a interface of the patient simulation training. So on the left-hand side, you can start a new conversation, and then you start to chat about it by typing and interact with the simulated patient. Yeah, and on the right-hand side is the field of all the cognitive model components that you can write down during your chatting. Yeah, so when you finish, whenever the trainee feels they are ready to compare the answers, they can click this submit and review answers. And then the blue text here is the reference cognitive models that we fill to construct the simulated patient. Yeah, so they can get a real-time feedback by comparing this ground truth cognitive models with their reconstructed cognitive models. So for the experiments part, accordingly, we try to assess the following dimensions. The first, fidelity, whether the simulated patients actually resemble real patients. Second, accuracy, how accurately does our patient set emulate the underlying cognitive models, which is a core part of how to make the training effective. Yeah, finally, the effective, whether the trainee can get any improvements of the CPT skills, whether the trainee can get any improvements of the confidence. Yeah. So definitely there's no automatic way to assess all these complex dimensions. So we mostly rely on a user study. So we recruit 20 current mental health professionals and 13 social work students to get these comprehensive assessments from both the experts and the trainees. Yeah. So for each participants, we ask them to practice with our patient set and the GPT-4 baseline in a randomized order, and then finishing 2 sessions for each. So here for the GPT-4 baseline, we just prompted nothing and just said, okay, let's play a patient. Yeah. So next is about all the results. And first, it's about the fidelities here. And we compare the patient set with the GPT-4 baseline. We compare patient set with the traditional, and we also compare GPT-4 with the traditional by asking the participants to fill out a survey. Yeah. And then by looking at the table, you can see that for GPT-4 baselines, mostly the patient set outperforms both the GPT-4 baselines and the traditional methods like the students role-playing in classroom a lot. Yeah. So this is a more fine-grained breakdown of the fidelities here. Yeah, you can see we also assess these fine-grained dimensions of how the patients resembles the these bad cognitions, emotional states, and conversation styles of a real patient. Yeah, we can also say that compared to the GPT-4 baselines, our patient size take a majority of these winning votes. Yeah, and next is about the accuracies here. How accurately does our patient simulation resembles the underlying cognitive models? Yeah, you can see these results of all the components of the cognitive models like core beliefs, coping strategies, and emotions, behaviors, intermediate beliefs, so on and so forth. You can see that all the experts, they gave a rate of nearly 97% of the patients is at least moderately accurate in reflecting the underlying cognitive models. Yeah, so this result guarantees that the trainees can actually get a good feedback by comparing their formulations with the ground truth cognitive models. Yeah, and next is about the effectiveness of the training. So specifically, whether practicing with our tool can give you any perceived improvement on the skills and perceived confidence improvement. So left-hand side shows you that by comparing our patient-side tools with both the GPT-4 baseline and the traditional training method, like we can see that they all, for both expert and trainees, they all think that this is pretty more effective than this old baseline set method. Yeah, on the right-hand side, it's a perceived confidence improvement from the trainees. By practicing with our tools, they can get more confidence improvement before interacting with the real patient. Yeah, so and here's a fine-grained breakdown of various dimensions of this training effectiveness. You can see that our method can greatly improve the training of helping to identify the maladaptive thinking patterns, to identify the beliefs, and then to improve the overall skills. Like our framework get a majority votes here. Yeah, so that's all about the introduction of this work. I think okay, my time is really 5 minutes left now. So about the let's finally summarize about some future work. So in this work, everything we did is just we directly prompt the GPT-4 with the cognitive models. Yeah, and also in our user studies, we actually found that the experts is still tells us there's a lot of limitations for our current simulations. Like sometimes the patient is just too straightforward and tells you too much about themselves. And sometimes they're overly pleasing and then they talk too much. Yeah. So it's still pretty challenging that how to improve this. Like instead of using prompting and directly using those commercial APIs, can we actually train a better open source model of ourselves to simulate more realistic patients? Yeah, if so, how to create training data for such case? They are both really challenging. Yeah. And also second, in this work, we only target the training of reconstructing the cognitive models in CBT, which is especially the early first phase of a CBT therapies. There are also many other sessions, like in later, after you identify these cognitive models, how should you perform modifications on it? How should you modify these bad thinking patterns to more healthy ones? Those are all the stages that can leave us future works here. Yeah, and also go beyond cognitive behavior therapy. How can we apply this to other therapy paradigms? They are all very valuable future directions that I'm interested. Yeah. So yeah, that's all for this talk. And yeah, thank you again for coming to my talk. And any questions?
Okay, great. Thank you, Zoe. Any questions from the audience? Yeah, I do have a question. So you create the patient simulator, but your application is more on the therapy, like how the doctor can, the patient can see doctor in rural area. But so here your patient is more training, right? So what is the real world application for your model?
Yeah, I think for this work, we build this I am a simulated patient for the train the mental health trainee. So in real world, the application is more like the things that interface here that before they